here at the International Institute of Health Sciences, where they're partnering up with National Health Services UK in order to bring in better and brighter opportunities for our nurses in Sri Lanka globally. And today is the signing of their MOU. My name is Dima. Stay tuned with Hi Events to find out more.
Welcome to the MOU signing ceremony between International Institute of Health Sciences, IIHS, and NHS, the National Health Services UK. We're extremely pleased and privileged to welcome a galaxy of experienced professionals to this wonderful event. And as you're aware, it is tradition to do a welcome speech for any event. We welcome Dr. Nihal De Silva, the Dean, Co-founder and Chairman, the Board of Directors at IIHS.
Welcome everybody, and I see that we have the team from NHS here. Today is a historic day for IIHS because we are going to sign a memorandum of understanding both for IIHS and for the NHS. We started IIHS around 2002, and so we are now in our 20th year of operation.
It is my pleasure to invite the next distinguished speaker. He needs no explanation because he is currently leading the innovative organization IIHS. Please join me welcoming the co-founder CEO of IIHS, Dr. Kitsiri Edrisinghe, to deliver his speech on IIHS model to fulfill the demand for global nurses.
This is indeed a great milestone for Sri Lanka, as well as obviously for IIHS. Foundation has been to work with international organizations and especially health related to healthcare training, and then now we have gone a mile ahead, working with the industry with a view to have a smooth transition of these trainees that we graduate. Once Vivian Green said, the life is about waiting for the storms to pass. It isn't waiting for the storms to pass. It's about learning how to dance in the rain. That's what we all did. It was a difficult journey from its beginning. As you all know, we have regulated industries. We are in a regulated industry. It was not easy to even start a training school in nursing. And thanks to professionals like Dr. IIHS De Silva, who was the Director General and was the Minister of Health. From its inception, he has supported us. What we are trying to do here is to train, support some of the Sri Lankan nursing professionals to secure some job opportunities at NHS UK. So we are basically looking at about 100 to 200 nurses this year to move them. And parallelly, we had discussions yesterday for the caregivers or the care assistant also to move in the same way.
So with that, as you're aware, today's event is all about the collaboration with NHS Northwest and East of England. Therefore, it is my privilege to invite the next distinguished guest, Mr. Paul Morris, the Director of Nursing, James Padgett University Hospital, and Senior Responsible Officer for the International Recruitment in Norfolk and Waveny. Mr. Paul, the podium is yours.
Thank you very much for inviting me to speak today, and I will just say a few brief words. It's a great privilege to be here as part of the East of England, the Norfolk and Waveny International Recruitment Hub, representing a wide range of acute, community, mental health and social enterprises all come together to work together in our recruitment of international nurses. What has been really impressive since joining, working together with IIHS and the faculty here is although the NHS and IIHS are separated by thousands of miles, our fundamental values are exactly the same. The high quality education and training is outstanding. I'm really privileged to be welcomed by you all and excited to the next chapter as we start to see Sri Lankan nurses and unregistered professionals working in our care system.
Dr. Craig, I wish to invite you to speak to our guest about the Coventry University partnership and the way forward.
Coventry University is probably one of the leading international universities in the UK in terms of the number of students we have around the world undertaking a Coventry Award. IIHS has gone from strength to strength. We've added more and more degree programs during that time, so we now have bioscience. I'm looking at Dr. Kaseri to keep reminding me and giving me the nod. We are introducing some really exciting programs, so digital health, which we're seeing an immense interest in around the world, and IIHS yet again will be our first international partner to launch that. And it's great to see institutions like IIHS who are going to be instrumental in enabling us to train the next generation of health workforce, specifically around nursing and midwifery.
So with that, we have come to the most important part of our ceremony, which is the MOU signing between IIHS and NHS.
I have Dr. Kitsiri Singh here with me on quite a momentous day, if I say so myself. We've got NHS partnering up with, for the first time actually in history, with a private educational organization in South Asia. So how do you feel about this day and the partnership?
Well, firstly, I'm humbly very proud to be in this particular occasion. The IIHS has about 20 years of history in training healthcare professionals, especially nurses. So we are the leading brand in nursing education in Sri Lanka and in South Asia. This particular partnership is a milestone of not only for Sri Lanka but the whole of South Asia, simply because once you complete a degree, you have to move into a job. So when you move into a job, you have to go to a stable job with a stable partnership. So National Health Services UK is the health system in UK, and then we are working with part of that trust called NHS East of England. So that's a collaboration that we have. Now, as we all know, there are nearly over 10 million nurses are needed in the world today. So this, so as the UK, they have 50,000 nursing vacancies today. So we are working alongside with NHS to how to get these students from Sri Lanka graduates to migrate them. So firstly, we are looking at the existing nursing professionals. We upgrade them to a bachelor's through Coventry University and Open University Malaysia, both. And then we will move into, there is a pre-registration program. So having a degree won't allow you to get the registration in UK because it's a regulated market. So we have a separate program for them to get the English competency and then also technical competency, and then we'll introduce them to the NHS, and they will organize visas, etc., and they'll migrate into UK. The beauty of this program is there are no agents involved. This is directly going through there are no agency fee involved. All but they have to pay is the educational training fee, which is also be subsidized with the support of a bank. So bank gives a loan to these nurses, then they can move on to NHS. So and the beauty of this particular entity is that they can earn about £25,000 per year. That's a basic salary that they get. That's a lot of money in today's context. And then they can move on as they go on with their specializations. A. B. They can take their family. And the husband can work full time, and it's a very inclusive trust, and they support the kids to have free education. I mean, imagine a Sri Lankan nurse working in this very frugal environment and working in NHS in a top-end environment. So we have to give this opportunity for these nurses who have really worked hard in Sri Lanka, and they really deserve, truly deserve. At the end of the day, it's much better to export nurses rather than housemaids. And then not only economically it's viable, it will bring more dollars to the country, but it will improve the image of the country. And the second phase of this particular MOU is that we are also training caregivers or care assistants to NHS. So we are hoping to train sizable amount for them to move. That's also without agent, they directly taken over by the NHS. So this is what we really wanted to do, work with the industry. And when we work with the industry, we know to train our training capacities also and change the way that they want. So they would have a very sustainable job and a very fruitful life.
I have with me Dr. Nihal De Silva, who is the mastermind behind the inception of IIHS. Now, Dr. Nihal, when you started this IIHS 20 years ago, did you ever think you'd come to such great heights that you'll be training nurses to migrate to UK?
Well, I never dreamt that we would come to this level, but we have. And at the moment I'm very emotional and I'm full of memories. I thank everybody who supported us to get here. We had many people who believed in us. We ourselves, we didn't compromise our principles. We stuck to our goal and vision, and without making too much of noise, we managed to move forward. And as you said, we are very proud that we are now going to be serving the National Health Service of the UK. Hopefully in a big way, and hopefully in a way that Sri Lankan youth will have, respectable opportunities to go abroad and do something for themselves and for the sake of the country. Yes, I feel extremely proud and, as I said, very emotional, especially when I think of our humble beginnings, when our entire school was about half the size of this hall. And today this hall is named after me, which is in a way very unusual, but that's the way it is. We have a lot of potential. We are now expanding and forming what is called a multi-university. We are expanding our courses, our specialties as it were, and we are going to have some added facilities like for research, for student accommodation, for enhanced sports facilities, and also get the community involved so that we will be part of a community rather than just an educational institution. Plans are well underway, and it's at Karavalapitiya, not too far from here. So that is our next goal, and over the next 4 or 5 years we are hoping to complete it, and it's going to be a new campus with a new definition of the word campus. That's the way it is.
Lots of bigger and brighter things to look forward to, and we wish you all the very best.
Thank you very much. Thank you.
Dr. Amal Harshad De Silva with me now. Doctor, I see you all the time. You come here to IIHS all the time, and today has been quite a momentous day for IIHS. So tell us a little bit about what the contribution it is that they do for health service field of Sri Lanka altogether.
Yes, Dima, I think it's a great milestone when it comes to IIHS and also for Sri Lanka, because we have been waiting for the day that how our kids can be value added before they go abroad. And this is exactly what's happening in IIHS today. And then that's happening with a great institution like the NHS UK, It's one of the greatest institutions that they respect all over the world. And then for our children to work for the NHS is a great achievement. And therefore now once we get the training and the Coventry University is giving the certification, and then they will have access to the world of healthcare. And once you practice for the NHS, that means you are recognized all around the globe. And therefore Sri Lankans will be caring for everybody in the world in time to come. Therefore I think our Kid Series plan, IIHS plan, is to train 100,000 caregivers and give them access to the NHS, and also train some nurses and give access to the UK. And therefore this will transform Sri Lanka, because we have a big foreign exchange problem at the moment, and I think this can give a major solution in time to come.
Lots of good things to look forward to.
A lot of good things to look forward, and I think it's a great union and a great MOU signed today, and hope that this will bring about great results for Sri Lanka.
I have with me Mr. Paul Morris, who's here at IIHS. Now, what made you actually pick IIHS as an institution in Sri Lanka to partner up with?
IIHS is a solid organisation with many years' experience. The real foundations of their values and beliefs really sit well with the NHS. The focus around innovation, patients at the centre, and their local community is important skill sets to fit with the NHS. Their high quality training is exceptional, and their understanding of the workforce needs and their development needs from all backgrounds, and making it accessible from those from whether rural areas or in a city, academic or non-academic, is really important. The development and growth of staff, keeping the patient at the centre, is vital for those values in the NHS. And we clearly see those with our partners here at the IIHS.
Sounds fantastic. So lots of opportunities to look forward to for us as Sri Lankans while we are partnering up with NHS.
Absolutely. Once the programme is started and we've got our first Sri Lankan nurses across, we're really excited to see how their growth and development, the opportunities for them to grow, develop, both in their practice as well as in their personalities as they grow in confidence, because there are differences in our healthcare systems and the role of the nurse in the UK versus the role of the nurse here in Sri Lanka. It's really exciting to know that advanced practice, those skill sets and developments will be available to them. But also what they bring, their high quality educational standards, their core values will add a fresh eyes to the NHS, and they will also bring skill sets to us. So we're really excited because it's a true partnership.
Miss Emma Walklin here with me. Lovely to have you in Sri Lanka. And let's talk a little bit about your thoughts of our nurses here in Sri Lanka and how NHS intends on supporting them back in the UK.
Thank you so much for having us first and foremost. I think what we've seen in a really short time is that actually the Sri Lankan nurses are professional, they're compassionate and caring, and they're very well educated. So that gives us a really great opportunity to welcome your nurses into our local health and care system. I think what Norfolk and Waveney does really well is have our workforce at the heart of everything that we do, so that we're making sure that if we've got happy, healthy professionals working for us, the outcomes for our patients is going to be so much better. So we have a strategy for workforce across our system, so it's called We Care Together. So I think what we can offer to nurses coming over to our system is actually really immersing them in the culture that we have for our own staff at the moment. So that's access to education and training. It's thinking about new opportunities to development, and that's within roles, but also thinking about career development, talent management, and working across a range of disciplines. So, and all of that is underpinned by a culture of values and respect. So I think what I'm really looking forward to is really getting to know the nurses, really understanding more about the Sri Lankan culture, what we can learn from you, and also what we can provide back. This is such a great partnership arrangement, and I can't wait to see how it progresses.
I have Mr. Neil Fisher here with me talking about the possibilities that we have for the future with Sri Lankan nurses. So what are the kind of possibilities that you actually see for them to be encouraged to move into UK and NHS as well?
Well, we've been here over the last week talking to Sri Lankan nurses about everything the NHS has to offer in terms of careers. We try to create the most welcoming environment possible for anybody that moves to the UK to come and work for the NHS. But also we try to make sure that they're really well looked after when they arrive. So we like to think about things like having the right accommodation, having the right links to local communities, being able to access some of the things that might remind them of home. But further than that, we obviously want to think about their career progression, what's on offer for them in terms of their development. So we realise that they're becoming to a new world of work, a new community, but we want them to settle in really quickly so they can start to think about where their career might want to take them. So the NHS has lots of opportunities for specialist nurses, lots of opportunities for management positions, and we really encourage our nurses to embrace those opportunities and to take it as an opportunity to learn new things and see where they can go.
Johnson here with me. Let's talk a little bit about the opportunities that our nurses will get where mental health training is concerned.
Sure, I think one of the first things I'd like to say is I think mental health is everybody's business, no matter what branch of nursing you move into. So you could be a cancer nurse or a cardiac nurse. People have mental health, and it's really important to remember that. So our program's going to do two things. One is those people who want to come in and work in mental health. We have a wide range of services from children, adults, older people, people who are at risk of causing criminal damage or criminal harm as well. But physical health nurses, we also want to raise the awareness of mental health and well-being, because your patients who are in bed or who have been told they've got cancer or life-limiting illnesses also will have an emotional impact towards those sorts of information. So for me, that's our programme, twofold. Come along and work in mental health, but also if you're a physical health nurse, understand what mental health means for your patients.
So is there any special kind of training that you're planning on giving us, the nurses that you recruit from Sri Lanka?
Yep, so our Mental Health Foundation programme is going to look to equip nurses with what is best practice for mental health, what we're doing currently in the UK, listening a lot to our service users who tell us what it's like to be treated by our nurses. So there's a lot of training that we'll do, and also we'll be looking at people's career development. So it's not just about coming in and filling a place, but actually we want clinical leaders for the future as well. So we want to develop our nurses to really grow and become an integral part of our NHS family.
I have with me Miss Diane Baye. I hope I got your name right. And as somebody who's been living in UK for quite some time and been working there as well, what sort of insight would you give to our nursing professionals who plan on moving on to the UK?
It's a good question. So I came to the UK alone, and it was a daunting idea, but I think it was the right decision to make. I think the UK is a very welcoming place. People are really supporting, very welcoming. And I think that daunting thought is the same for our nurses who are planning to join us in the east of England. But what I want to say is they will be well supported. So if they decide to come and join us in the east of England, I think it will be great. We as the NHS, we will be there to support them throughout, as we always do. And yeah, I think it'll be a great experience, a great learning experience, exchange of knowledge, skills, and more. You bring culture into the NHS as well as you take from it. So yes, that's what I think is the answer for that question. I hope that's the right answer.
Fantastic. So it sounds like it's very welcoming. So why wouldn't anybody want to walk in?
A really welcoming, supportive. Yeah, everyone's really welcoming and really supportive. So I think our nurses will have that support right throughout, from the community as well as from the NHS.
Dr. Craig Blight with me from Coventry University, who's going to talk a little bit about the partnership that the Coventry University has with IIHS. Welcome to Sri Lanka, Doctor, and tell us a little bit about the plans you have going forward.
Sure. So Coventry University has been in partnership with IIHS since 2013. We initially set up our partnership with what we call a progression agreement. So we had lots of the great IIHS students would come to the Coventry campus in the UK. But since 2018, we've been delivering in partnership with IIHS a number of courses here in Sri Lanka. So we deliver the BSc in Nursing Studies, an MSc in Advanced Physiotherapy Practice, and we've recently added a number of other courses in areas such as bioscience. We're looking at things like radiography, so a whole range of allied health courses. We're really excited at Coventry to be working with such a great partner as the International Institute of Health Sciences. I'm really looking forward to, we hope, many years of growth going forward. I think for the whole world, the recent pandemic has highlighted just how important our great nurses, midwives and health staff are. And hopefully Coventry and IIHS will be able to play a part in delivering the future workforce in those areas.
I have with me Engineer Dr. Lionel Pinto here with me, who's going to talk a little bit about the collaboration that we have something to look forward to.
Yeah, exactly. That's a very good question and a very good move that the IIHS is associating with the Skills Development Fund. We are coming under the purview of the Ministry of Vocational and Technical Education, and that we have realized this initiative is a great stride for the national economy of the country, because we need the skilled personnel to get trained and see and go abroad and get more training, further training, and then some foreign exchange to the country. And in my experience, I have seen the skills development and the technical education is the backbone of the country. So keeping that in view, that we are giving all the support for this initiative.
Opportunities to look forward to as IIHS joins hands with NHS to bring opportunities for our nurses here in Sri Lanka. Until we see you again with another high event, take care and be safe.